Alrighty, let's go on and talk about the autonomic nervous system. It's a fun chapter because you get to learn about how, all right, the other division of your nervous system is going to operate. All right, now when we talk about the structural and functional organization of our nervous system, when we're dealing with the structural, we're dealing more with the anatomical. And so our structural organization for the nervous system is going to be made up of the central nervous system, which is the brain and the spinal cord, and then our peripheral nervous system, which is pretty much everything else, which is really the ganglia and the nerves themselves out there in the peripheral nervous system. Now, when we get into the functional organization, the physiological actual workings of our nervous system, we have two ways that we break that down. We have our somatic nervous system and our autonomic nervous system. We're going to be talking about the autonomic nervous system, but to help you to understand a little bit, we should at least mention what the somatic nervous system is, right? And so what I tell folks, the somatic nervous system is basically everything that you can consciously perceive or voluntarily control. So we're consciously being able to perceive the sensory input, and we can voluntarily control the motor command output. So when we break down the somatic nervous system, we have our somatic sensory. Again, that's going to be all that information that you're able to take in that you can consciously perceive as to what's going on. Touch, taste, all right, sight, sound, equilibrium, smell, all that. Those are our special senses. And then from our general senses, that's the information that comes from our skin and proprioceptors, things like vibration, temperature, pain, right? All of that is included in the somatic sensory. Somatic motor, again, is where we're going to have voluntary control over the effectors, where there's only one type of tissue that we have voluntary control over, and that's the skeletal muscles. So the somatic motor is going to include those voluntary movements that come from the cerebellum, the cerebrum, and also any reflexive movements that involve the brainstem or the spinal cord. All right, so we'll have cranial reflexes and then spinal reflexes, which we talked about in chapter 14. So here's just a quick overview of our somatic nervous system. And so you can see here, I'll zoom in a little bit. All right, we have our sensory receptors out here in the skin or wherever we're talking about. That sensory input travels up on our sensory neuron, enters into the spinal nerve here, goes into the spinal cord through the posterior roots. Only sensory neurons are found there. Then, when we want to elicit some sort of motor response or process, all right, we have our motor neurons, which will be found here in the anterior gray horn of the spinal cord. And that motor neuron will exit out of the spinal cord through the anterior root. Only motor neurons reside there in the anterior root. It'll enter into the spinal nerve and then exit out into somewhere into the body, but eventually winding up to our somatic motor tissue, which is going to be skeletal muscle. And that's just a basic overview. We should pretty much have a pretty decent understanding about how that somatic nervous system, all right, process works. Now, excuse me, let's talk about the other functional organization of the nervous system, the autonomic nervous system. Okay, our autonomic nervous system, also known as the visceral motor system, all right, when we're dealing with the motor output. So when we're dealing with the autonomic nervous system, a lot of those processes that we'll discuss and you'll learn in much more detail and when you take Bio 211 is going to happen below your level of consciousness. So you might not even be able to perceive it. You're not going to notice when your heart rate goes down by 5 beats a minute. You're not going to notice when your blood vessels vasodilate by 2 times what they were previously just a few moments ago. These things you really won't notice. So with our autonomic nervous system, the output, the motor output is going to come from your central nervous system to your effector organs, which are going to be cardiac muscle, smooth muscle, and glands. You really need to know that. Okay, so when we're dealing with the autonomic nervous system, specifically the motor aspect of it, the nerve signals come from the central nervous system, and they're going to go out to the tissues that you have no voluntary control over. And we know you can't control your heart. Okay, so cardiac tissue, you can't control smooth muscle. So smooth muscle and then glandular responses. So how this all works is, first we have to get sensory input, and that comes from the viscera, right? That is another word for our organs, but that includes blood vessels, like your stomach, your pancreas, your lungs. All of that is going to send sensory input into the autonomic nervous system. All right, so the main purpose of the autonomic nervous system is to do what we talked about, which was critical in chapter 1. Maintain homeostasis, maintain that healthy balance, right? Your body has ranges for certain physiological processes. Heart rate, 60 to 100 beats a minute. Breathing rate, 12 to 18 or 20 breaths a minute, right? Body temperature, 98.6, but there's a range for that, right? Blood pressure, right? 90 over 60 is the low, 140 over 90 is the high. We want to maintain it in that range, hopefully somewhere around 120 over 80, maybe a little bit lower than that, just to be on the safe side. So that's what these systems are going to do. And that's what the autonomic nervous system's job is. It is there to make sure that homeostasis is maintained, that these different systems, these different tissues are going to operate within their normal working condition ranges here. So if you look here at our picture, we're seeing, all right, our autonomic nervous system. And so you can see we're using the lungs as our organ here. So you have those visceral sensory neurons that are going to take that sensory input and transmit it up to the central nervous system. Now there's some other structures here we haven't gotten into that we'll talk about here shortly, but they're going to send that visceral sensory input eventually into the spinal cord. And then that sensory input is going to be processed in our central nervous system. And then the motor output, okay, we learned with the somatic nervous system that the motor neurons, the cell bodies, were located in the anterior gray horn. Well, now, when we're dealing with the autonomic nervous system, our autonomic motor neuron is not going to be located in the anterior gray horn, but the lateral gray horn, right over here. So it'll exit out of the spinal cord, much like the somatic motor neuron does, and it exits out through the anterior root back into our spinal nerve. And then we're going to go over all the different pathways that it'll take to eventually get to the effector. And here, our effector, if we're dealing with the lungs, we could be dealing with the bronchioles. We might want to cause some constriction of the bronchioles, so we'll activate the smooth muscle in the bronchioles to make the airway passages smaller for whatever reason. All right, so we're going to learn about all this, all right, today. Or actually, I take that back. We're going to review it because I'm assuming that you've already learned some of this, and now this is just going to be some review for you. So let's talk about a lower motor neuron of the somatic nervous system versus one of our motor neurons of the autonomic nervous system. And we talked about how that lower motor neuron of the somatic nervous system is going to reside. That cell body is either going to be in the brainstem, if we're talking about one of our cranial nerves, for example, or in the spinal cord, we'll have our cell body in the anterior gray matter. And so this motor neuron is going to leave the central nervous system and go all the way out to the skeletal muscles. And so the neuron is actually going to be one of the larger neurons, normally an alpha motor neuron, which has the largest diameter or the largest type of nerves in the somatic nervous system, and they're going to be myelinated. So that signal, those action potentials are going to travel quite quickly. And they're going to use acetylcholine as the neurotransmitter that's going to always excite the muscle fiber. All right, this is in the somatic nervous system. We're going to see something different when we get to acetylcholine's neurotransmitter properties when we get to the autonomic nervous system. But in the somatic nervous system, that motor neuron is going to release acetylcholine from the synaptic knob onto the skeletal muscle fiber to excite the muscle fiber to contract. So we should know all this. We're pretty good with that. So what about, all right, these lower motor neurons in the autonomic nervous system? Okay, a little bit of a different story here. So follow me here. Instead of one motor neuron, we are going to have two motor neurons that are going to go out to our effector. To review, the effector is going to be cardiac muscle, smooth muscle, or glands. So instead of having one, we have two. So the first neuron is what we call the preganglionic neuron. Because when one neuron synapses on another neuron, normally that occurs in the ganglia in the peripheral nervous system. So the first motor neuron in our autonomic nervous system is going to be called the preganglionic neuron. And its cell body, again, is going to be similar to the somatic nervous system. It's either going to be in the brainstem or the spinal cord. Now, a couple characteristics. These preganglionic neurons are going to be smaller, but they will be myelinated. Okay, so they're thin and myelinated. And so they're going to exit out of the central nervous system and wind up in what we call an autonomic ganglion. That's going to be somewhere out in the periphery. And we'll talk about where it'll be located. But for right now, our preganglionic neuron is going to exit out of the brain stem of the spinal cord, okay, and go to an autonomic ganglion somewhere. And then it'll synapse onto the postganglionic neuron. Now, the preganglionic neuron is going to secrete acetylcholine as its neurotransmitter. And so here we see it exciting that secondary neuron or the postganglionic neuron. Right, so there's some similarities here between the somatic nervous system, the motor neuron there, and the autonomic motor neuron here. Some similarities. So our second neuron, right, to be honest with you, I call it the postganglionic neuron. It's just easier to figure out which is which, right? You have a preganglionic and a postganglionic neuron. So the cell body here for the postganglionic neuron is going to be located in the autonomic ganglion. Well, that makes sense because that's where the preganglionic neuron wound up. It went to go synapse on another neuron in a ganglion somewhere. So these neurons are big difference here, much thinner than the other two neurons that we just talked about, and they are unmyelinated. And so this postganglionic neuron is going to wind up synapsing, all right, onto the effectors, which are going to be, and you're going to keep hearing me repeat this because I want to make sure this is in your head, cardiac muscle, smooth muscle, or a gland. Now, here's something new. These neurons, these postganglionic neurons, are going to release either acetylcholine or norepinephrine. Right? And so that'll either excite or inhibit the effector, which makes sense because if we want to slow down the heart, or if we want to stop peristalsis, which is the movement of food product through your digestive tract, we can inhibit the effector, inhibit the smooth muscle. So it's no longer moving that food through the digestive tract. So we'll talk about some of the effects here in a moment. But you should know these basic qualities of the two motor neurons here of the autonomic nervous system here. So here you can see, I love this picture. It's a great picture. Let me zoom in a little bit here. Okay, so here's our preganglionic neuron. Right, it's in the lateral horn, or gray horn here, of our spinal cord. It is myelinated. It is thin. It exits out through the anterior roots, goes into the spinal nerve, and then it's going to travel out to some ganglia somewhere in the periphery of your body. And so it'll synapse and make contact with another neuron, which is our postganglionic neuron. And so our preganglionic neuron will release its acetylcholine into the synaptic cleft. It will then stimulate the postganglionic neuron through a specific type of receptor called nicotinic receptors, which will then stimulate that and excite that postganglionic neuron. And that postganglionic neuron will exit out of the autonomic ganglion and head out to the effector, which is going to be either cardiac muscle, right, smooth muscle, or a gland, and it will release either acetylcholine or norepinephrine, right, onto the effector organ. And then we have a whole range of different physiological responses that can occur. All right, so there's a reason why we have two neurons in our autonomic nervous system chain compared to just the one lower motor neuron that we saw in the somatic nervous system, right? There's two concepts here. One is called neuronal convergence. So we'll see many preganglionic neurons are going to synapse all onto one ganglionic neuron. And then the other is what we call neuronal divergence. So we'll see, all right, an axon from one preganglionic neuron synapsing with many, all right, postganglionic neurons. So you can get more of a wider, diverse kind of response here. All right, let's get into what controls the autonomic nervous system when we're dealing with the central nervous system's influence here. Okay, so what is the central nervous system? That's our brain and spinal cord. We already know this, right? So specific parts of the brain and the spinal cord are going to regulate and control our autonomic nervous system. The hypothalamus, we talked about this way back in chapter 13, plays a huge role in controlling the autonomic nervous system. There's two divisions. We'll talk about that momentarily here. There's two divisions of the autonomic nervous system. The hypothalamus influences both of those divisions. Okay? The sympathetic is our fight or flight, which is our emergency system here. Okay, so we'll see how, for example, when you are stimulating that fight or flight response, usually there is an emotional response connected to that. Generally, it's fear, right? You're scared for your life. A bear is chasing you. You need to run away. Okay, and so your sympathetic nervous system kicks in and you're running fast. But usually it's that emotional response, that fear, that helps with that actual reflex of maybe running away from a dangerous stimuli. We'll also see parts of the cerebral cortex play a role in this. The thalamus, of course, plays a huge role. Obviously, when we're dealing with that relay system there. And then, of course, if we have some sort of emotion, then we are going to tie in the limbic system into all of that. Now, next semester, and I know I keep saying this a lot, but in Bio 211, you're going to learn about a lot of the different systems that remain in the body: digestive system, urinary system, reproductive system, right? So a lot of those systems rely on visceral reflexes, right? And a lot of those visceral reflexes, the brainstem plays a huge role. So when we were going over the different parts of the brainstem, specifically the medulla oblongata, we talked about how there's a lot of autonomic nuclei that reside in the medulla oblongata. So you'll see in more detail the role that the brainstem plays in these visceral reflexes. We talked about it: the cardiac output, respiration rate, your vasomotor control center, which helps to maintain blood pressure. So we get to learn about all that stuff, not today, all right, but in the second half of this course here. And then we'll also see how the spinal cord is going to play a role in some of our autonomic reflexes there. Right, you'll see the importance, right, especially when it comes to defecation and urination. Unfortunately, for some folks, if they suffer a spinal cord injury, then those two reflexes, defecation and urination, become compromised, and they may have some issues for the remainder of their life. And that plays a role in the autonomic nervous system because the parasympathetic division of the autonomic nervous system governs defecation and urination there. All right, so let's talk about those differences, all right, those two divisions. So we have the parasympathetic division. It's known as the rest and digest. This is kind of where you replenish anything that you have expelled, like if you've gone for a run or if you've done any type of physical activity, we need to restore, all right, our supply, our energy supply. And so the parasympathetic division plays a big role in that. Also helps with conservation of energy. All right, big reason why after you have a big meal, all right, sometimes you feel a little bit tired. Well, that's your parasympathetic division going hard at work on trying to conserve energy and replenish any diminished energy supply. Plus, it'll help with the healing processes that are going on in your body. The other division is the sympathetic division, the fight or flight. All right, this here is part of our survival mechanisms in our body, but when you're exercising, you're engaging the fight or flight, right? When you get excited, especially maybe when Christmas is coming up or your birthday's coming up and you get those butterfly sensations, you are stimulating the sympathetic division there. And obviously in life or death situations or emergency situations, the sympathetic division is in high, what's the word I want to use? It's in high impact. It's going on quite a bit. So what we see is a lot more people spend more time activating their sympathetic division of the autonomic nervous system than the parasympathetic. And that can lead to some health consequences. So we always try to encourage people to get some relaxation time in, take things easy, turn down the sympathetic division and turn up the parasympathetic division. This slide here shows you some of the differences, all right, when we're talking about our lower motor neurons between the parasympathetic division and the sympathetic division. I'm going to go through these right now. So another name for the parasympathetic nervous system is the cranial sacral division. And after I describe this to you, you'll see why. I think I have, oh good, I got the slide right there. All right, the cranial sacral division, all right, we're going to see that means we're involving, all right, some of our cranial nerves, okay, specifically cranial nerves 3, 7, 9, and 10, and then which come off the brainstem, and then off of the spinal cord, right? The sacral division is going to be in our S2 through S4 spinal nerves there. So the preganglionic neurons, remember our lower motor neurons have a 2 neuron chain. All right, the preganglionic neurons are going to be found in the brain stem, which is our cranial nerves, which is cranial nerves 3, 7, 9, and 10, or in the spinal cord at levels S2, S3, and S4. Right. So some of the physical characteristics of those preganglionic axons are going to be, these axons are going to be long, which means the postganglionic axons are going to be short. And since that's the case, that means the ganglia are going to be close or actually within the effector organ. So you might see some of the ganglia, for example, when we're looking at the intestines, you might see some of these ganglia right inside the walls of the intestine. So that preganglionic axon has got to extend all the way from the brain stem or from the spinal cord at S2, 3, or 4, all the way out to the actual wall of the tissue of let's say the small intestine. And then we have a very short postganglionic axon inside of that organ there. Our preganglionic axons will have fewer branches. Because keep in mind that I know for the most part, when I've shown you pictures of a neuron, it's usually cell body with several dendrites, then one single axon that terminates to multiple synaptic knobs. But what you don't understand is some of those axons will have branches that come off. We call those collaterals. And those branches might go to a completely different location. They might synapse on another neuron or synapse on another effector organ. So when we're dealing with the parasympathetic, all right, division, the preganglionic axons have very few branches. Now, in the sympathetic, we also call it the thoracolumbar division. So we'll see a lot of axons coming off the thoracolumbar portion of our spinal cord. So the preganglionic neurons are going to be located in the lateral gray horn of our spinal cord, located at T1 through L2 segments of the spinal cord. So that's pretty much all of the thoracic division of the spinal cord, and L1 and L2, so the first couple of segments in the lumbar division. So in the sympathetic division of the autonomic nervous system, the preganglionic axons are the opposite of what we saw with the parasympathetic. They're short. And the postganglionic axons are long. So since the preganglionic axons are short, the ganglia are going to be close to the spinal cord. And there's a certain structure that I'm going to bring to your attention here in a few moments when we're talking about these ganglia here. But the preganglionic axons will have many branches, so we can get a much more diverse reaction when we're stimulating the autonomic nervous system of the sympathetic division there. So if we look here, I love this picture. Here's our autonomic motor nervous system. We break it down into the two divisions here. Parasympathetic, also known as the craniosacral, and the sympathetic, also known as the thoracolumbar division. So you can see here in our parasympathetic, the cranial portion is made up of these 4 cranial nerves. You need to know that, okay? Oculomotor, facial, glossopharyngeal, and vagus. Okay, so those are the 4 cranial portions. And then our sacral portion is S2, S3, and S4 segments of the spinal cord. You can see how they're located way down here. And then those segments will help to form the pelvic splanchnic nerves, which we'll talk about if we have time later on. So here in our parasympathetic division, you can see the preganglionic axon is nice and long. And then our autonomic ganglion, right, will be close to the effector, or actually within the effector organ's wall there. And that's due to the fact that our postganglionic axon is so short. All right, so what do we see here with the parasympathetic division? We're going to govern our homeostasis and do rest and digest. Conserve energy, restore energy, any energy stores that have been depleted. All right, just take things easy. We need to focus on homeostasis. In our sympathetic division, all right, again, always trying to maintain homeostasis, but that's our fight or flight. Okay, increases alertness, and it will increase certain metabolic activities like energy production for your skeletal muscles when you're trying to run away from that bear. So our sympathetic division is known as the thoracolumbar division. And you can see most of these lower motor neurons are going to be located here in the thoracic spine and in the lumbar, small amount in the lumbar spine. All right, so from T1 all the way down to L2, that's what we'll see the sympathetic segments coming off. And then our sympathetic division, you can see here is our preganglionic neuron. It's short, but we have several branches coming off. And so our autonomic ganglion is going to be close to the spinal cord. And our postganglionic neuron is nice and long. All right, so let's go over, okay, the parasympathetic nervous system, the cranial component, the 4 cranial nerves involved. Ocular motor is the first one, cranial nerve 3. So we're going to see, all right, in cranial nerve 3, our preganglionic axons, all right, they're going to, the cell body is going to be located in the midbrain there. And so they're going to exit out of the midbrain, out of your brainstem, close to the eye, and they are going to synapse at the ciliary ganglion, which is located right in your orbit. Again, close to your eye. And then the postganglionic axons are going to exit out and go out to the effector organs. In this case, it is going to be dealing with the ciliary muscle. This is the muscle that is going to change the shape of your lens. So you can focus on objects if you're looking far away, and then you look at something close, you can focus on that object that's close by the ciliary muscle manipulating the shape of the lens to focus the light rays so you can see something clearly. Also, it is going to control, all right, the muscle in the iris sphincter there, and it'll cause pupillary constriction. So when you are shining the light into somebody's eye, okay, you will be utilizing, what happens is that the pupil will constrict, right? And that is testing out the parasympathetic division there of cranial nerve 3. All right, facial nerve, cranial nerve 7. Whoops, I don't know why I did that. All right, facial nerve, cranial nerve 7, its preganglionic cell bodies are going to be located in the pons. That's that second segment of the brainstem. And it's going to exit out, all right, of the brainstem, and it's going to travel, all right, to 2 different ganglion, the pterygopalatine ganglion and the submandibular ganglion. All right, the pterygopalatine ganglion is going to control the tears that are being produced in the lacrimal gland. So the pterygopalatine ganglion will be close again to your eye, right? But it's going to stimulate the lacrimal glands, and it's also going to stimulate glands located in your nose and in your mouth. So if you're getting a runny nose, you can thank the pterygopalatine ganglion. All right, the postganglionic axons that are going to be emerging from the submandibular gland, well, that's easy to know. Submandibular is going to be salivation. So it's going to affect 2 glands, the submandibular gland and the sublingual gland. So again, our preganglionic axons, which are located in the pons, are going to exit out of the brainstem and travel to either the pterygopalatine ganglia or the submandibular ganglia. And they'll synapse onto the postganglionic axon. And then those postganglionic axons will either go to, right, the lacrimal gland, right, by the eye, or the glands in the nose and mouth. And then those postganglionic axons that exit out of the submandibular ganglion will go to the submandibular and sublingual glands for salivation. All right, glossopharyngeal, cranial nerve number 9. All right, the preganglionic axons, those cell bodies are found in the medulla oblongata. And so they'll exit out of the medulla oblongata and then synapse in the otic ganglion onto the postsynaptic ganglions. This is going to be located near your ear. And so the postganglionic axons are going to stimulate the saliva of the parotid gland. The parotid gland is the largest of your salivary glands, but believe it or not, it does not produce the majority of saliva. All right, so that's cranial nerve number 9. And then one of my favorites, the vagus cranial nerve. I've told students this in the past. If you're taking a test and you have no idea what the answer is, and you want to take a wild stab at it, if the vagus nerve is one of your answer choices, circle it, okay? Because vagus does a lot. It does a lot. So the preganglionic axons, all right, are going to be found in the medulla oblongata. So the cell bodies of those preganglionic axons located in the medulla oblongata are going to exit out of the brainstem. Now there's too many, all right, ganglia associated with the vagus nerve. I could spend a lot of time here, all right? Just know that there are many ganglia that are located throughout your thorax and your abdomen, to which these preganglionic axons will synapse onto the postganglionic axons. And then those postganglionic axons will go out to a variety of tissues and organs: heart, lungs, blood vessels, bronchioles, okay, all over the place, down to various digestive tissues. Okay, so there's a whole bunch. So you can see here, all right, these postganglionic axons will play a role in slowing down the heart, causing bronchoconstriction of the lung bronchioles, those breathing airways there. All right, it will stimulate the digestive system to start producing more secretions there and help us in the storage of carbohydrates through the process of glycogenesis, is one example. All right, so you'll learn more of the role of vagus nerve when you get into some of those varying systems there, the respiratory system, the cardiovascular system. But for our purposes for this chapter, just know that it has its hands in a lot of different organs and tissues there. All right, so that's the cranial portion of the parasympathetic division. How about the pelvic or our sacral division? Okay, our sacral division is made up of S2, 3, and 4. All right, but we are actually going to create what we call the pelvic splanchnic nerves. And the pelvic splanchnic nerves, okay, we're going to see their preganglionic axons, their cell bodies are located in the lateral gray horn of the spinal cord, specifically at segments S2 through S4. And so, of course, those preganglionic axons will exit out of the spinal cord and they will synapse, all right, through there. We'll talk about this, all right, at various terminal or intramural ganglia. These are the ganglia that are really close to the organs themselves. And so they'll create, all right, what's known as the superior and inferior hypogastric plexi, or plexi, I should say. And our postganglionic axons are going to go to a variety of abdominal and pelvic effector tissues, mainly smooth muscle, right, that we'll see throughout our digestive system, our urinary system, and even parts of our reproductive system, all right, when we're talking about, all right, penile and clitoral erection, all right, we'll see how it plays a role there in our reproductive systems there. So here's a nice just overview here of the parasympathetic pathways, and you can see there's a lot here. I mean, I could spend several class periods about talking about the neurophysiology of just the parasympathetic nervous system alone. But basically, this picture is showing you what I just discussed with you. Here you can see the ocular motor nerve, all right, the preganglionic axon synapsing on the autonomic ganglion, here in the ciliary ganglion, and then our postganglionic neuron traveling over here to the lacrimal gland. I'm not going to go through all these again. All right, but just if you want, take a look at the pictures. They'll give you an idea, all right, as to the vast array of all these functions that the parasympathetic nervous system it plays a role in here. All right, sympathetic division. All right, fight or flight. We are going to use the sympathetic division in times of exercise, emergency, all right, where we need energy. So we also call it the thoracolumbar division. So the ganglia are going to be close to our central nervous system, primarily the spinal cord. So we're going to go through now a whole bunch of different pathways that the sympathetic division utilizes, all right, in our bodies here. All right, so let's start off here and talk about where we're going to find parts of the sympathetic division. So let's start off with the preganglionic neurons. The cell bodies to those preganglionic neurons are going to be located in the lateral gray horn, all right, specifically at T1 through L2 of the spinal cord. And so these preganglionic neurons are going to exit out of the spinal cord through those anterior roots. Those are only motor neurons that travel there. And so they will exit out of the spinal cord through those specific spinal nerves of T1 through L2. And now we're going to talk about, all right, what happens to them when they branch off. All right, so one of the structures that we need to talk about, we briefly made mention of this in the previous chat session, is the sympathetic trunk. And the sympathetic trunk, all right, has sympathetic trunk ganglia associated with it. And this describes it perfectly. It's like a pearl necklace. And I'm going to try to do my best. So you have a ganglion, and then it gets thin, then you'll have another ganglion, all right? Kind of like a pearl necklace, but with a lot of spacing in between the pearls. So as we know, all right, the actual pearls are going to be the ganglion, and that's where the cell bodies will be. And then the thin part here, like the string, that's just going to be axons, specifically axons. So I'm going to kind of walk you through where we're going to see, all right, the sympathetic trunks and these ganglia. Normally, like I said, they're going to be close to the spinal cord. So we're going to see them on either side of your vertebral column, on the left and on the right. And it's just going to be on either side. So just lateral to the right and the left of the vertebral column here. Thought I had a picture. I don't. Okay. So here's what we're going to see. Right, some of our not patterns, right, but some of the phenomena that we're going to view here when we're talking about the sympathetic trunk and the ganglia is pretty much each spinal nerve will have one ganglia for the most part. Okay, but we're going to see some differences here. When we get into the cervical spine, okay, it's a little bit different. We're going to have three ganglia. A superior cervical ganglia, a middle cervical ganglia, and an inferior cervical ganglia. Right. Other than that, for the most part, what we're going to see is one ganglia per spinal nerve. Cervical region, throw a curveball, it's a little bit different. So in the superior cervical ganglia, the postganglionic axons are going to go to the head, neck, and the organs in your thorax. So this is going to include sweat glands. When you sweat, that's a sympathetic response. All right, the blood vessels too are going to be stimulated by the superior cervical ganglia. All right, the dilator pupillae muscle, that's the muscle that dilates the pupil. Okay, so interesting fact, when your pupil constricts, that's a parasympathetic response. When your pupil dilates, that's a sympathetic response. So how I remember that phenomena is when you see something that scares the heck out of you, what do you usually do? Your eyes get big, they get wide, they open up really wide, and your pupils dilate. That's what happens, right? So that's a sympathetic response. Well, parasympathetic is the opposite. So the pupils constrict, that's a parasympathetic response. We also have a muscle in your eyelid, the superior tarsal muscle, that is also going to be innervated by the superior cervical ganglion. Now our middle and inferior ganglion, all right, these ganglion are going to have, their postganglionic axons are going to innervate various organs in the thoracic region now. So when we look at this picture here, check it out. Let me just zoom in here. So here are our superior, middle, and inferior cervical ganglia. So you can see those postganglionic axons going to various structures in the head and neck, also contributing some postganglionic axons to the cardiac pulmonary plexuses, which will go to various organs in the thorax, whereas the middle and inferior ganglion will contribute postganglionic axons that only go to the thoracic viscera there. Now, if we scroll down here, check this out. Look at all of these neurons here that come from T1 through L2. All right, so the preganglionic neuron go out to, and we'll talk about these ganglion here in a second, go out to various autonomic ganglion out in the periphery there. Again, that's going to be close. They're going to be close to the spine, okay? And then they'll travel out, the postganglionic neurons will travel out to a variety of tissues throughout your abdominal region there and into the pelvic region. And we'll talk about some of that. Pretty crazy. All right, so let me see if I got the picture here. I didn't include it. Boo on me, bad boy. Okay, so, well, I kind of can use this. Let's just zoom in here real quick, just a quick overall review here of spinal anatomy. Okay, you've got your spinal nerve with our posterior root with sensory neurons only going into the spinal cord, and then you've got your anterior root with motor neurons exiting out of the spinal cord. So what you'll see is you have your spinal nerve, and it will give off a branch that is going to head posteriorly towards your deep muscles of your back and the skin under your back. And that branch is called the posterior ramus. And the posterior ramus does just that. It's going to innervate, all right, the deep muscles of your back, and it gets sensory innervation to the skin on your back. Once the posterior ramus has branched off, all right, the spinal nerve is no longer known as a spinal nerve. It is now known as the anterior ramus. And the anterior ramus will do some things. All right, we're not going to talk about that right yet. But we'll see there are two branches, small branches, that come off anteriorly. All right, and we call those the rami communicantes. And so those rami communicantes act as an on and off ramp into our sympathetic trunk and our sympathetic ganglia. And so this is that pearl necklace structure I was telling you about that runs parallel on either side to your vertebral column. And we'll get into the specifics there. All right, but I want you just to know some of those vocabulary terms there. So the rami communicantes, all right, are the on and off ramps into the sympathetic trunk here. Now there's a gray rami communicantes and a white rami communicantes. And so the white is myelinated. The gray is unmyelinated. All right, and we'll get into more of the specifics here. I just wanted to throw that out at you real quick in case you weren't sure about that. All right, so that brings me here. Wait, where am I? Okay, yep, I'm on the right page. Okay, so that brings me here to the gray and white communicantes. This is how the spinal nerve connects to the sympathetic trunk. So think of the white rami communicantes as the entrance ramp. So they are myelinated, right? And if they're myelinated, that makes them the preganglionic axons. So the white rami communicantes are going to carry the myelinated preganglionic axons from T1, anywhere from T1 to L2. So they're going to exit, all right, those spinal segments will exit out of the spinal cord, and they're going to enter the sympathetic trunk through the white rami communicantes. Now we're going to talk about what happens then, because they can either synapse there at that level, they can travel up or down, they might not even stop at that level, they might just exit out, okay? But what we will see is the gray rami communicantes, that's the exit ramp. So when something is leaving the sympathetic trunk, okay, it's going to exit out of the sympathetic trunk through the gray rami communicantes, and it's gray because those postganglionic axons are unmyelinated. All right, a couple other things I want to mention to you. the sympathetic splanchnic nerves, and the prevertebral ganglia. The sympathetic splanchnic nerves are going to be, all right, axons, this is important, that do not synapse in the sympathetic trunk. And I'll show you a picture here in a second. What will happen is these preganglionic axons will enter into the sympathetic trunk, but they will not even synapse, and they'll leave it. They'll just run in for a brief second and then run out. And so these specific splanchnic nerves are going to travel out to our prevertebral ganglia. And we'll talk about those. All right. So consider this: the sympathetic splanchnic nerves are preganglionic axons that don't synapse in the sympathetic trunk. And so they are going to exit out of the sympathetic trunk anteriorly, pretty much right in front of your spine, and they're going to terminate in our prevertebral ganglia. And so there is 3 prevertebral ganglion that I'd love to talk to you about. Right, these ganglion are going to be found right in front of the vertebral column, and they're closely located to certain areas of the abdominal aorta. So we're going to see these ganglia only in the abdominal pelvic cavity there. So there are 3. We have our celiac ganglia, our superior mesenteric ganglia, and the inferior mesenteric ganglia, which is convenient because you have arteries that come off of the abdominal aorta. You have one structure called the celiac trunk. Then you have the next artery that comes off, the superior mesenteric artery, and then the next artery that comes off after that is the inferior mesenteric artery. So these ganglia are located right around those arteries there. So it's easy to remember their names. So the first prevertebral ganglia is the celiac ganglia, okay? Hangs around our celiac artery. And this is where we're going to see, all right, some of our splanchnic nerves, specifically what we call the greater thoracic splanchnic nerves, are going to enter into the celiac ganglia. And so they'll synapse onto the postganglionic axon. And those postganglionic axons are going to innervate your stomach, the duodenum, you remember that, the first part of your small intestine, your spleen, liver, gallbladder, and pancreas. So that's a lot. So the celiac ganglia innervates quite a bit. The next prevertebral ganglion is the superior mesenteric ganglia. Of course, it's going to be located near the artery of the same name. And so our lesser and least thoracic splanchnic nerves will enter into this ganglia. And those postganglionic axons are going to innervate parts of the small intestine, the large intestine, the pancreas, the kidneys, and the ureters. And then finally, our last prevertebral ganglion is the inferior mesenteric ganglia, again, located near the artery of the same name. Our lumbar splanchnic nerves will enter into this ganglia, and its postganglionic axons are going to innervate more parts of the large intestine, the rectum, which is near the terminal end of your digestive tract, all right, bladder, ureters, and your reproductive organs. I want to say I had a picture of this. Oh, we'll get there. We'll get there. I'm jumping ahead. Sorry. Okay. So now that we know some of these different structures here, some of our prevertebral ganglia, our sympathetic chain, and our sympathetic chain ganglia, I want to talk about our sympathetic pathways. And these are basically, all right, a number of pathways. There's going to be 4 pathways that we're going to go over here. And it's going to show us, all right, the pathway that the axons will take, all right, once they leave the spinal cord and go to wherever. So let's start off with the spinal nerve pathway. So we need to know, all right, what effectors the spinal nerve pathway is going to affect. So any of the effectors that are located in the skin of the neck, your torso, and your limbs. So again, sweat glands are a perfect example. So the spinal nerve pathway is going to affect these sweat glands there in your neck, your torso, and your limbs here. So our preganglionic neuron, okay, resides, the cell body is going to be located in the spinal cord. And so it's going to exit out of the spinal cord, and that preganglionic neuron is going to enter right into the sympathetic trunk via the white rami communicantes. And we're going to see it synapse with our postganglionic neuron inside of our sympathetic trunk ganglia. That postganglionic axon is then going to exit out of the sympathetic trunk ganglia through that gray rami communicantes, but it happens at the same level, the same. And so what we'll see is it exits out of the gray rami communicantes, and then it's going to join back up with that same level spinal nerve, and it's going to head out and go out to the effector organ. Let's show you a picture. Spinal nerve pathway. Okay, so let's start off here. Here is the cell body for our preganglionic neuron. And it's located in the lateral horn, the lateral gray horn. Now, this is the anterior gray horn. The lateral gray horn is off to the side. So it exits out of the spinal cord, goes into the spinal nerve. All right, and what we're going to see is it's going to enter into the sympathetic chain. All right, the sympathetic chain ganglion. Now, here's the thing. It has three choices to what it can do. Okay, it can immediately synapse with the postganglionic neuron, and then that postganglionic neuron can exit out of the sympathetic chain, and then it can go to a variety of places. It can go to the posterior ramus or the dorsal ramus, okay, or it can go into the anterior ramus. It goes out to the effector organ. That's what this diagram is showing you. It's heading out to an effector organ somewhere. All right, that's one option. Okay, another option is it can do the same thing. It can enter into the sympathetic chain, and it doesn't synapse, and it goes up a level. But wherever it goes up, once it synapses, it has to leave at that level. Okay, so it can travel up a level, it can travel up 2 levels, 3 levels, whatever. It can go up, synapse, but once it synapses, it has to leave at that level. Its third option is it can enter in, same story, okay, and it can descend and go down a level or 2 or 3. And then the same story, it can synapse onto the postganglionic axon and then, or neuron, and then it has to exit at that level. So a spinal nerve pathway has 3 choices. Okay, the preganglionic neuron can come in and synapse on the postganglionic axon, but it has to leave them. Or it can enter in and it can go up a level or 2 or 3 or whatever, and then it synapses, then it exits out that level that it synapses, or it can come in and it can descend and go down, and then it synapses and it exits out at that level. But that's what we're going to see. All right, wherever it synapses, it then has to leave. It has to go. All right, and when it leaves through the gray rami, and it goes out to the effector. Okay, somewhere, one of those effector organs in the neck, torso, or the limbs. Okay, the next pathway is going to be our postganglionic sympathetic nerve pathway. So now we're going to talk about how we're going to affect some of these organs or these effector tissues, all right, inside the thorax, all right, and the neck. And we're going to see some of the skin effectors of the head and neck. And check it out, we're going to deal with the eye, the eyelid there, and the dilator pupillae muscles. So what we're going to see here with our postganglionic sympathetic nerve pathway, that preganglionic neuron is going to enter in to one of the ganglia, and it's going to then synapse in the sympathetic trunk ganglia. And then from there, that postganglionic axon is going to go directly to, all right, the trunk ganglion, or excuse me, it's going to go directly from the sympathetic trunk ganglion to the effector. Let me show you. Zoom in here. That might have been a little bit confusing, but I'll show it to what I'm talking about. All right, so here we have our preganglionic axon. All right, it enters into the sympathetic chain. All right, so it can ascend a level, okay, it can go down a level, but regardless, right, it is going to then synapse, all right, at a level here, all right, and you can see in this case, all right, how it does not exit out of the gray rami. Okay, in this case, it's going to head out, all right, from that sympathetic ganglia directly to, all right, one of the effector organs there. And then it'll synapse onto the effector organ. All right, so just to review, the preganglionic neuron is going to enter in to the sympathetic trunk ganglion, and it's going to synapse onto the postganglionic axon. Then that postganglionic axon is going to go not through the gray rami communicans, all right, but it is going to go directly from that sympathetic trunk ganglion out to the effector. And that's what we're seeing here in this picture here. So this is going to occur in our head, neck, and then the viscera, all right, of the thoracic cavity and some of the viscera located in your head and neck. All right, our next pathway is the splanchnic nerve pathway. This nerve pathway is going to be for the effectors in the abdominal pelvic cavity there, or the abdominal pelvic viscera there. So here's an important concept that you need to understand. The preganglionic axons are going to go into the sympathetic trunk, but they will not synapse there. Okay? They will not synapse. They will pass right through, right, the sympathetic trunk, and they will go directly to one of those prevertebral ganglia that I was telling you about, either the celiac ganglia, the superior mesenteric ganglia, or the inferior mesenteric ganglia. Then that's where they're going to synapse. And then the postganglionic axons go directly out to the effectors. So you remember those three different ganglia that I was telling you about, the prevertebral ganglia. So here in this scenario, you'll see our preganglionic axon, again, it enters into the sympathetic trunk, but it does not synapse anywhere here. And so it enters in and it directly leaves, and it makes a beeline straight to one of our prevertebral ganglia, either the celiac, the superior mesenteric, or the inferior mesenteric ganglia. They'll synapse onto the postganglionic axon, and that postganglionic axon or neuron will head out to the effector organ. All right, we will see this at various abdominal and pelvic viscera there. And then our last pathway is the adrenal medulla pathway. The adrenal medulla pathway, okay, this pathway is real simple. It's pretty much going to be, all right, one neuron that goes directly out to your adrenal glands. All right, so this is for, all right, the adrenal gland, but specifically the medulla of the adrenal gland. And that's like the center of the adrenal gland. That's what produces epinephrine and norepinephrine, what some people like to refer to as adrenaline. All right, so our preganglionic, all right, axon is going to go all the way through the sympathetic trunk, and it's going to go through the prevertebral ganglion without synapsing in either of those places. And it's going to synapse all the way. I mean, well, it's going to travel all the way, all right, to our adrenal medulla cells that produce epinephrine and norepinephrine, and it's going to directly stimulate those cells to release those hormones into the blood, all right, fight or flight. We've learned in chapter 14, right, when we were talking about the reflexes and how the fewer synapses you have, all right, the quicker the reflex. Monosynaptic reflexes are usually faster than polysynaptic reflexes, fewer synapses. Well, guess what? We don't even have a synapse here, all right? We don't have, it's all one neuron. So it's one chain. So we have our preganglionic neuron exiting the spinal cord, goes into the sympathetic chain, does not synapse, goes to your prevertebral ganglion, does not synapse, goes directly to the adrenal medulla, causes the adrenal medulla cells here, they're called neurosecretory cells. They're going to release the epinephrine, the norepinephrine directly into your blood. So one chain, real simple. All right, that brings me to the concept of autonomic tone. It's an important concept. You really should make sure that you understand this pretty well. But when we're talking about our effector organs, all right, cardiac muscle, smooth muscle, and the glands, all right, normally these effectors are going to be innervated by both the divisions of the autonomic nervous system. And what we'll see is both divisions are going to be continually releasing their neurotransmitter onto the effector. And we call that the autonomic tone. And so what we'll see is eventually, all right, one of those divisions is going to take precedence over that effector. So for example, we're talking about the blood vessels here, right? Normally, our blood vessels are in a partially constricted state, which makes sense because, all right, the sympathetic neurons are going to be releasing the neurotransmitter onto the blood vessels and keep them in this partially constricted state. So now let's say, all right, we want to increase that constriction. Well, it's like turning up the dial on your stove, your oven. You want to turn up the heat, all right? If it's a gas stove, you turn it up. You want to make the flame hotter, all right? All we're going to do is turn that up. And so what we're going to see here is if we turn up, if we increase our sympathetic activity, then we'll increase the amount of vasoconstriction that goes on. If we want to turn down that, if we want to increase vasodilation, then all we have to do is turn down our sympathetic activity. So in this situation, what we're looking at is one division, the sympathetic nervous system, is going to control the status of this effector, which is our blood vessel diameter. And that's going to help deal with blood pressure, for example. And so we call that vasomotor tone. All right, we'll see something similar to that, all right, in the heart when we're talking about the vagal tone. Because if you didn't have autonomic nervous system innervation of your heart rate would be way faster than what it is now. It'd be over 100 beats a minute, closer to, I want to say, about 120. Okay, but because of the vagus nerve constantly releasing neurotransmitter onto these cardiac muscle cells, it will decrease the heart rate. So the vagus nerve has that, we call that the vagus tone. It's going to continually decrease the heart rate. So that brings me to dual innervation. How one organ can get input from both the sympathetic and the parasympathetic divisions. All right. A lot of times we'll see that the divisions will have an antagonistic effect, but in some cases we'll see it has a cooperative effect. I'll talk about that in a second. The antagonistic effect is going to be opposition to one another. Okay, we saw how the biceps brachii and the triceps brachii, how they affected the elbow joints. All right, the biceps brachii flexes the elbow joint. The triceps brachii is going to extend the elbow joints. Those are in opposition to one another. So when we talk about the antagonistic effects here of the sympathetic and parasympathetic divisions, we can look at the heart rate, for example. Parasympathetic is going to slow your heart rate down, whereas the sympathetic will increase the heart rate. Easy to remember, all right? And that's because the cardiac cells have two different types of receptors there. And those two different types of receptors are going to either allow an increase in the heart rate or a decrease in the heart rate, depending on which receptor is being activated. All right, GI tract motility. All right, the parasympathetic nervous system is going to increase your GI tract motility. Makes sense, you know, because it's the rest and digest division, whereas the sympathetic division is going to decrease the motility. That also makes sense because think about it. You don't have time to be digesting a meal that you had 5 hours earlier if you're running a race, a 10K. And plus, we need to use our resources in other areas that might need maybe more blood, okay, for some of our metabolic processes for exercising skeletal muscles here. So we'll see here with our GI tract, all right, another antagonistic effect because again, both of the cells for the smooth muscle cells in the GI tract will have both types of receptors. And so depending on which receptors we activate will determine if we increase or decrease the motility there. All right, diameter of the iris. Okay, remember what I said. The parasympathetic nervous system is going to decrease the diameter of the iris. It'll make it of the pupil. It'll make it smaller. Whereas the sympathetic is going to cause dilation of the pupil and make it bigger. And so the parasympathetic division is going to innervate the circular iris muscles, which act like a sphincter. So when they contract, they make the pupil smaller. Whereas the sympathetic fibers are going to innervate the radial iris muscles, which kind of, I'll try my best to do a drawing here. There's the pupil. The radial iris muscles surround the iris and they're arranged like this. And so what will happen is when those muscles get stimulated, there's a better picture in chapter 16, which demonstrates this. So when those muscles are stimulated, or when that muscle is stimulated, your pupil gets really big. I'm not going to draw all those lines in there, but you get where I'm coming from. You know what's up. All right, so continuing on with dual innervation, like I said, you can have antagonistic effects or cooperative effects. Our cooperative effects is where both divisions, all right, play a role in getting us to the same end result. So for example, all right, when we talk about male sexual function, all right, the parasympathetic division is going to attain erection of the penis, whereas the sympathetic division will cause the ejaculation during intercourse. So again, both divisions play a part in our overall response for whatever it is that we're going to undergo. All right, so systems controlled only by the sympathetic division. I mentioned this briefly. I talked about blood vessels here, all right, and we'll see how you can get varying opposing effects, all right, without having both divisions of the autonomic nervous system being utilized. And the blood vessels are a perfect example because we have that vasomotor tone constantly going on because the sympathetic nervous system is constantly releasing, all right, the neurotransmitter to keep those blood vessels in a partially constricted state. So if we want to increase the amount of constriction going on, we just increase the sympathetic nervous system activity. If we want to cause vasodilation, we just turn the dial down on the sympathetic nervous system, causing it to release less neurotransmitter, and then that causes vasodilation. All right, we can see it here in the sweat glands. Remember what I said, the sweating is a sympathetic response. So again, only one division is going to affect, all right, sweat glands. Erector pili muscles, those are the smooth muscles in the skin that will actually attach onto the hair follicle And so when those muscles contract, they create what we call goosebumps or goose flesh that's only innervated by the sympathetic division. And then that last pathway that we talked about for the sympathetic pathways of the autonomic nervous system, all right, the adrenal medulla is controlled by the sympathetic division to stimulate the neurosecretory cells to release epinephrine and norepinephrine. Which brings me to the final part, I think the final part, our autonomic reflexes. Folks, this is just going to be a brief introduction to what you are going to get blasted with in 211. So if you have a pretty decent idea of this, then when you go through 211, you will do very, very well. So quickly, the autonomic reflexes, we're dealing with visceral reflexes, which are going to be reflexes involving organs of specific systems throughout our body. So keep in mind, or we talked about this in chapter 14, reflexes have several different characteristics. They're pre-programmed, which means it's going to happen the same way every time, right? They're rapid, all right? We are going to see how it's being a pre-programmed response. You might not even know of a reflex occurring until it's after it's happened. So we're going to apply everything that we learned in the reflex arc in chapter 14 here to our autonomic reflexes, which means we have to start off with a stimulus, and then that stimulus is going to activate a receptor, and we know the rest of the story. That receptor is going to send that sensory input along the sensory neuron to the central nervous system. And then that's the central nervous system is going to be the integration center, that control center there, which is going to then process that information and then determine what type of response we are going to have. Once it determines that, it sends its output, that motor command output through the motor neuron directly to the effector organ, which is what we've been doing for the past hour, been talking about that. All right. So of course, don't forget what your effectors are. All right, cardiac muscle, smooth muscle, and the glands here. So the cardiovascular reflex, again, you'll go into this more detail, but quickly, blood pressure. Okay, you have these receptors that are in your blood vessel walls. And so they monitor the amount of pressure that is going on inside of these structures based on the amount of stretch that the blood is pushing on those walls with. And so when we see an increased amount of stretch, that's usually due to an increase in the pressure of the liquid in the blood vessels, which is the blood. So that information travels up to the medulla oblongata, specifically the cardiac center there. And then the cardiac center is going to respond by trying to reduce the amount of pressure in the blood vessels. How does it do that? It's going to inhibit the sympathetic nervous system because the sympathetic nervous system controls the diameter of the blood vessels. So it'll cause vasodilation. So the diameter becomes bigger. That will help to decrease the pressure. And it's going to activate the parasympathetic nervous system to decrease the output of the heart. It's going to decrease the heart rate, and it's going to decrease how hard the heart is contracting. All of that is going to decrease our blood pressure. It's a beautiful thing. That's our cardiovascular reflex when it comes to blood pressure. Gastrointestinal, right? When we're talking about going to the bathroom, doing number 2, going poopy on the potty, all right? As parents like to say to their kids when they are potty training them, right? You have these sensory neurons, again, in the rectum that are going to respond to stretch based upon how much fecal matter is accumulating in the rectum. So as it increases and there's more fecal matter there, more stretch is going on, all right, that the rectum sensory neurons that are going to travel and send sensory input to the spinal cord, right? Spinal cord is going to integrate that information, process it, and then it's going to then send motor commands down through the motor neurons to stimulate the rectum, the smooth muscles in the rectum to contract. Whereas at the same time, the internal anal sphincter will relax, and then the external anal sphincter is under skeletal muscle control, which is what you've learned to control when your parents were toilet training you. So you will allow relaxation of the external anal sphincter, and then you can actually defecate and get rid of that fecal matter. The micturition reflex for urination, same thing. Okay, your bladder fills with urine, increases the amount of stretch on the bladder walls there. All right, that sensory information gets sent back to the spinal cord, specifically in the sacral region of the spinal cord. And then the spinal cord activates the motor neurons to send that motor command information down to the smooth muscles of the bladder and the urinary sphincters. Now, we have learned how to relax our external urinary sphincter, right, when we were toilet trained. And so we relax the external urethral sphincter along with the internal urethral, I can't talk today, urethral sphincter, and the smooth muscles contract to squeeze the urine out of the bladder and out of the urethra and out of your body. And so that's what we're seeing here. Okay, so you can see how as the bladder fills up with urine, it's going to press on the bladder walls here. That will then stimulate the sensory neuron, all right, with sensory input information here, and it sends it to the spinal cord in the sacral region there, and then the sacral region of the spinal cord will then send out motor command information to the smooth muscles here in the urinary bladder, causing them to contract. It'll also stimulate the internal urethral sphincter muscles to relax. And then the external urethral sphincter muscles down here, we control under skeletal muscle. And so you're able to relax that, and then the urine can pass and leave your body. Folks, we did it. We managed to finish. I'm very, very proud of you for putting up with me.